Hi Sunny, welcome back. My name is Wendy and I will be your trainer today. Today we are doing a 10-minute balance and flexibility program, so let's get started. Hi Sunny, welcome back. My name is Wendy and I will be your trainer today. Today we're doing 10 minutes of balance and flexibility for your little pregnancy. So let's get started. We're gonna go wide leg stance here. We're just gonna work on those hamstrings a little bit. If you have tight hamstrings, that can lead to lower back problems. It can lead to hip problems, hip pain, poor movement systems, poor alignment. So let's just stretch those hamstrings out. So your toes can point forward or they can point slightly out, whatever feels most comfortable to you. Really all of the movements that I do today, I want to encourage you to just do what feels best for your body and move slow. Let's transition over to the other leg. So this leg is a lot harder for me to stretch down to. So if you have to take a slight bend in your knee, soften that knee a little bit, it is okay. You can also do like an extend and bend. I don't know if you can see that slight of a movement, but it kind of just works into that muscle a little bit more since this leg is way tighter for me. Again, this is just gonna reduce hip pain, lower back pain, and help you posturally. Let's come to center, and you can kind of just rock back and forth here, allowing those hips to open up a little bit. Taking some deep breaths. All right, let's stand up slowly. You can push yourself up if you need to. Similar stance, we're gonna go a little bit in from that, not as wide. We're gonna come into a deep squat. So coming down, I need to take a tighter stance. We're gonna come down into this deep squat. Bum comes down as if you're about to sit down on the floor, keeping that chest up. As you can see, you can keep your hands in if you'd like to. I'm using my elbows to push my knees out a little bit. This is gonna get a little bit deeper into my hip flexors and opening those hips and reducing that lower back pain again. If you wanna invite some movement into this, that's totally fine. Sitting straight up. So this would probably be hard while you're pregnant, but really when we start doing low, deep squats here, you want your toes to be forward as you're in this deep squat. If you need to go and rotate your feet out a little bit, that's totally fine. Sometimes it takes a little while to get into that. All right, let's stand it on up. Working on that balance here, we're gonna go into a standing folding floor. If you're like, look lady, I can't do that. You can grab a wall. You can also do a seated folding floor. You're gonna cross one leg over and we're gonna drop that butt back into this balanced stance right here. So working on your balance a little bit, we're working into that glute and that hip, making sure that your center of gravity is over your ankle. Let's take some deep breaths here. Coming on out, we're gonna switch sides. You'll notice that your ankle is kind of wobbly. It's okay, all the tendons and ligaments within your ankle are helping to support you there. And they're just trying to acclimate to the balance. So it's okay if it's wobbly. It's also okay if you fall out. Taking some deep breaths here. Working into that hip. Nice job. All right, coming out, we're gonna go into side steps here. So this is really strengthening strengthens your lateral balance as you move in and out. So go to the right, step back in, and to the left here. Out into that side lunge. We're gonna go arms extend up, arms extend back. Step it back to center. Other side, need to move over here. Arms extend up, arms extend back. Very good. Dropping back down. Ooh, hip, hello. Extend up, extend back. Not over extending that spine though, as you come down, keeping that neutral posture of your spine. Let's just do one more on each side, dropping down as low as you can, pushing that butt back. And one more. Awesome job. Stepping forward. All right, let's get down on the ground here. We're gonna go opposite arm and leg raise. So you're gonna be in all fours. So let's just talk about positioning first. Shoulders are right over wrist. Hips are right over your knees. And I want you to push up out of your upper back here. A lot of the times we'll collapse down into it. Let's lift that chest, opening up. So this exercise is really, it's working your hip flexors, it's working your abdomen, it's working your glutes as we lift up. So you're gonna go opposite arm and leg raise. So extending back. Let's take a beat there and coming back to center. Often you'll see the tuck here. I'm gonna keep from doing that. You can do that in pregnancy if you'd like, but I'm choosing not to because I don't really want to crunch. Nice. Extending out, lifting, squeezing into that glute, opening that hip flexor, extending that arm, opening that shoulder. Lift it up, hold for a beat as we balance here. Really making sure that you're not overextending that back, keeping that neutral spine and your hips face downward. You might notice that one side is more difficult than the other to lift up. That's okay, let's just take note of that. There might be some strengthening that can happen on one side or the other to kind of help support you for any postural imbalances that you're having. One more, keeping that spine really aligned again. Neck, head, shoulders. Very good, coming back down. All right, so let's move on to your back for a bridge position. So bridges are great, they really strengthen your glutes, and this will, as you strengthen your glute muscles, this will reduce any back pain that you have. You're also working your abs as you do this. So I want you to squeeze your bum and then lift up. Let's hold for a beat. Abs are engaged here, drop it back down. So again, squeeze your bum first and then lift. Pushing those hips up and out. You might feel a slight stretch in your quads as you do this. Squeeze and lift. Awesome. Let's do two more here. Squeeze and lift. We're gonna do a little bit of pelvic floor work after this because I'm feeling it a little bit in my lower back and I wanna give some attention to that. Squeeze and lift. And drop it back down. All right, so as you're in this lying position here, knees are bent, you're gonna have, I'm gonna exaggerate this, you're gonna have an arch in your back as you just lie here regularly. So what I want you to do is we're gonna close that arch out and you're gonna flatten your back onto the mat. So it's almost as if you're tilting your hips back, rolling that spine under slightly. It's not a real roll, but just squeezing those glutes to flatten that back onto your mat for this pelvic floor. And then we'll release. So coming back a little bit to that natural arch of your back, clenching everything, flattening that back, abs tight, hold for a few seconds and release. Nice job, let's just do two more. Flattening that back, press your spine into the mat. Very good, one more here. Nice job. All All right, so last movement here, we're just gonna twist, opening up, just giving yourself a little bit of a twist for your spine. And other side. And coming back to a neutral position. I'm so happy that you joined me today, and I hope to see you back here soon. If you've enjoyed this workout, I invite you to follow me on the SunnyFit app. There you'll find more classes from me. I teach mini stepper, meditation, and strength training. Plus, more from all of our SunnyFit trainers. If you haven't downloaded the SunnyFit app yet, click the link in the description below.